Before watching this video, don't forget to subscribe to my channel and ring the bell icon for more updates. If you are experiencing hip pain, but you're not sure what type of injury you have suffered, or how bad it is, this article should answer those questions for you. There are three main types of hip flexor pain. Pain when lifting leg. Hip flexor pain is often associated with pain while lifting the leg, but more specifically, pain only during this movement is usually a pulled hip flexor. Pulled flexor. If you have a pulled flexor, you may know it already. If you remember when it first started hurting, if it was during some sort of explosive movement, you probably have one. In order to test if you do, try standing on the opposite foot, then lifting your leg as high as possible, knee to chest. If you feel any pain at any stage, stop immediately. Once you have established that there is pain performing the knee to chest movement, it is almost certain that you have a pulled hip flexor. Please scroll down to the severity section to learn what his means. Constant pain. If you have nagging pain throughout the day, and it hurts when you move your leg or stretch your hip flexor, you may have a case of tendinitis. Tendinitis. Hip flexor tendinitis occurs usually with athletes as an overuse injury. Whenever a repetitive movement is performed, such as running or cycling, there is a lot of force being placed on the hip flexors. Often this will lead to inflammation of the tendon attaching the hip flexor muscles to the bone and will cause a lot of pain. Pain when touching hip area. A bruised hip flexor is an umbrella term describing an injury to one or more of the several muscles that the hip flexor contains. If your pain started after a blunt trauma to this area, you probably have a bruised hip flexor. Bruised flexor. It can be hard to tell the difference between a bruised and a pulled hip flexor, because you will often experience pain when lifting the leg either way. The difference is that in a stationary position, a bruised muscle will be very sensitive if you touch it. So to diagnose this, stand up and slowly apply pressure to the different parts of the hip flexor. If the pain felt while applying pressure is similar in intensity to the pain felt lifting your leg, you probably only have a bruised muscle. This is great news. Bruised muscles only require a few days of rest and you'll be ready to go, although maybe a bit sore. To speed up healing, apply a moderate amount of heat to the area 2 to 3 times a day with a heat pack or warm towel. This will stimulate blood flow and kickstart your healing system. Severity of injury. If you've identified that you have a pulled hip flexor, now we need to classify it into one of 3 types of pulls. After you have determined what class of pull you have, you can begin to treat it. First degree strain. If you can move your leg to your chest without much discomfort, you most likely have a first-degree strain. This is the best kind you could have. A first-degree strain means you have a minor or partial tear to one or more of the muscles in the area. Second-degree strain. If you had a lot of trouble moving your leg to your chest and had to stop part-way through, you probably have a second-degree pull. A second-degree pull is a much more severe partial tear to one of the muscles. It can cause significant pain and needs to be taken care of extremely cautiously in order not to fully tear the injured area. Third-degree strain. If you can barely move your leg at all, why are you reading this article? Go see your doctor right away and try not to move your leg if you can avoid it. A third-degree strain is a full tear of your muscle and requires a much longer time to heal. Please get your doctor's opinion on this before you do anything else. Hopefully you have identified your injury based on the type of pain you are having. If you are not confident in your ability to assess the degree of injury following the above instruction, please see a qualified doctor who can give you a second opinion. It can never hurt, but may help a lot. Information is power. You owe it to yourself and your body's health to understand your injuries. If you are able to understand injuries, you can diagnose them faster, treat them better, and recovery to the highest possible levels. If you need more information about a hip flexor injury and a permanent solution guide, click the link in the description below.